thank you very much for the opportunity to speak with you this morning. And I thought what I would just do today is just give you a brief update about some of the activities at Yellow Card Centre Wales and the MHRA. As you may be aware, the Yellow Card scheme was established following the thalidomide tragedy, and it has now been in place for 60 years this year. It was, as I said, it was in response to the thalidomide disaster. And the MHRA are the UK government body responsible for the safety of medicines and licensing. And the YCC Wales is funded by the MHRA to promote understanding, reporting and research of the side effects of medicine. Okay, so apologies. YCC Wales was established in 1983, and it's now one of 6 regional monitoring centres, as Claire has mentioned. We were originally 5 monitoring centres across the UK, but more recently, Northern Ireland has established a centre in Belfast. And our role has changed considerably over the years, and essentially we are now we promote education, promote yellow card reporting of side effects to medicines, and we also have a role in advising on adverse side effects or adverse reactions to medicines. Okay. As I mentioned, originally the scheme was set up to monitor the safety of medicines. More recently, there have been a number of developments. And one of those developments is the scheme has now been extended. And I think sort of particular of relevance this year is also now to include medical device incidents as well. So our medical devices can be anything from our insulin pens, syringes, could be needles, could be our devices such as our Libra, anything within the hospital environment that we use to deliver medicines. I think in terms of sort of for patients, it could be anything down to ventilatory devices, nebulizers, masks they may have at home, or anything that is related to the use of medicines. And the MHRA are now very keen that those any suspected incidents are reported via the Yellow Card website, and you go to the same site for all of these different products. So you can report side effects to medicines, vaccines, e-cigarettes as well, along with defective medicines or devices, or if you believe you've bought a fake product, and they can all be reported by the MHRA's website. COVID, at the present time, if you have a reaction to a COVID vaccine or anything other medicines that you take for COVID, there is if you go onto the main Yellow Card Centre page, there is a separate area for reporting side effects to COVID medications on the website. So whether that'll remain long term, I think is questionable, but at the present it does still exist. And so I think in terms of this has been a sort of major development for us, and we will certainly be considering sort of devices going forward in our Yellow Card reportings. We haven't quite decided yet how that will appear within our Yellow Card reports, because obviously our Yellow Card reportings is currently on the basis of adverse effects to medicines, and we've yet to iron out how our data will appear coming forward. Another important development that the MHRA has a new project which is called the Biobank, and patients in the future may be contacted to be asked to actually provide a sample for genetic analysis. Because what we know is that certainly some side effects to medicines have a genetic basis. And this program is at the very beginning, and patients or healthcare professionals who report side effects to certain medications will be contacted and asked whether they would be willing to participate in providing samples which will allow the genetic analysis to look into whether patients, certain groups of patients, because their genetic makeup may be more at risk to side effects of medicines. And in the first instance, the MHRA are going to limit their investigations to two types of medications. The first is the direct oral anticoagulant drugs, or more widely known as our drugs like rivaroxaban, tigabatrin, apixaban, edoxaban, and these are also blood thinners, and they're largely used in the prevention of strokes, but can be used in the management of DVTs and pulmonary embolisms, and they're also used in other conditions. They're also used following surgery, such as orthopedic surgery. If you have a knee replacement, you will be on these for a couple of weeks after to reduce your risk of having a clot in your leg post-operatively. And the other drug they're looking into currently is allopurinol, which is a drug which is predominantly used in the management of patients who have repeated episodes of gout. It's also used in the management of kidney stones and other kidney problems. It's also used in patients who are undergoing chemotherapy. And what we know is that there is a genetic link with some very rare but serious side effects to conditions like Stevens-Johnson syndrome, toxic epidermal necrolysis, and a drug reaction with eosinophilia systemic symptoms syndrome. And so certainly what we're going to see is patients or their healthcare professionals will be contacted, and you may well be contacted as a patient to see whether you'd be willing to participate in their study. As a patient, you can get involved. And so if you have actually experienced a severe bleed with one of the direct oral anticoagulants, one of our blood thinners, or you've had a serious skin reaction in the past, after submitting the yellow card to the website, your card will actually be assessed to see whether it meets the criteria, and then you may well be contacted. And if you are interested in finding out more, you can find that out at the yellow card mhra.government.uk biobank website. Or if you just put it into a Google search, you can find it on the latest news there. Okay. Along the line of what we've also talked about this morning, and I thought probably important to highlight as well, with regards to antimicrobial resistance, last week the MHRA has pledged to tackle this antibiotic emergency and have pledged 85 million to address this in the international community, as you know, as already has been recognised that this is a growing problem for us. More locally, I'm delighted to announce that back in 2013, we introduced Yellow Card Champions, and initially we had Yellow Card Champion across each of the health boards. They were largely pharmacists or pharmacy technicians, and they have basically helped us in disseminating information, workshops, engage with patients and healthcare professionals about yellow card reporting. And I'm delighted to announce more recently, having started with 11 or 12 champions, our community of yellow card champions across Wales this year has increased to over 80 yellow card champions. And certainly I hope as patients will be increasingly exposed to the yellow card champions, who will be able to advise them about side effects of medicines and reporting them to the MHRA. And as you can see, these are our yellow card reports. And over the last couple of years, we've had sort of some fairly substantial increases in our yellow card reportings. There's some slight unusual data here. So before 2021, these were our non-COVID vaccine reports. From 21-22 onwards, we've included our COVID vaccine reports. But if we take our COVID vaccine reports out of there, we can see our yellow cards reports within Wales are continuing to increase. And Wales still has the highest reporting rates of all yellow card centres across the UK per head of our population numbers. And we hope we will continue that. And what I really wanted to highlight to you, these are data from our annual report of 2023. Our current annual report is in the process of being produced, but what you can actually see here is the important contribution that everybody makes to this. And you can see here that certainly our patient, parent, carer, consumer group has contributed a significant element to our yellow card reports in 22 to 23. And we will hope that it's incredibly important that we receive yellow card reports, and patients and parents, carers have an important role to play in contributing to this reporting of side effects to medicines to the MHRA. So what should we report? Now, when a new drug comes to market, those drugs are often under intense surveillance, and they will have this symbol, this black triangle attached to them. And any suspected adverse drug reactions to black triangle drugs should be reported because these are under additional monitoring. And then for all other medicines and vaccines and established drugs, we should report in any serious reaction. And a serious reaction is basically something which could be fatal, life-threatening, leading to disability, prolonged hospitalization, anything which is medically significant, and congenital abnormalities. And I don't mean just physical abnormalities. It's also important that we think of neurodevelopmental conditions such as autism if we think there is an association with a drug used in pregnancy. And then it's also important for us to be aware that some adverse drug reactions may occur after medicine has been stopped. So always important, if you've experienced something new or unusual and you've recently had a medicine, always report that to your healthcare professional. And in terms of what we should report, we can, as I've already mentioned, medicines, medical devices, vaccines, are biological agents which are being used quite extensively now in the management of inflammatory conditions, autoimmune conditions, some types of cancers, along with blood factors, immunoglobulins. The MHRA are also interested in herbal preparations. And also, if you think you have been exposed to counterfeit or fake medications, you may be aware there's been a great interest in slimming preparations, which have been publicised on social media. And recently there were some which were contaminated with insulins and led to serious side effects. And certainly social media has an important role in terms of it has led to certain challenges that probably we hadn't faced previously. But we can also use social media for its positive benefits in getting out our message. And certainly if you follow us on social media, we regularly send out updates about some of the latest developments. Also, if you've had a medication error, a drug interaction, harmful in overdose. And then finally, I'm going to make a mention to borderline products. And there will be some agents which you don't know if they're a medicine. And these can include health food supplements and might even include the cosmetics industry. And my message to you is, whilst they're not technically, if you're uncertain, my advice would be to report it via a yellow card. And what we're asking you to report is, we're not asking you to prove you've had a reaction, but if you're suspicious you've had a reaction to anything, please do report it via the yellow card scheme. And with the data, I think a lot of patients often ask, what does the yellow card data do to improve patient safety? Well, any yellow card reports the MHRA receives are reviewed on a weekly basis. And if there are any signals which are generated, they will be looked into. And then in terms of what may happen with that medicine, is they may decide to continue to do increased surveillances. They may make changes to the advice regarding prescribing medicines, so they might restrict them in certain patient groups or add special warnings or precautions for patients or healthcare professionals. Some of the concerns we have sometimes is that by reporting adverse reactions, is that a drug will be withdrawn and patients will be denied access to this. Medicines are rarely withdrawn unless there are serious concerns about their use. And occasionally, the manufacturers themselves will actually make a decision to withdraw a medicine if patient safety is threatened. But ultimately, the role of the scheme is to make medicine safety for our patients. Okay, so in terms of reporting, historically, we reported by paper yellow cards. You can now report via the yellow card website, or you can download an app on the phone if you do have a smartphone. And the advantages of that is, if you use the yellow card app, is it retains your sort of demographic data, so that when you report again, it does allow you to do it with greater ease. And just from a patient perspective, this data is all, you can put your patient details in, but it is actually anonymised.